So how do you tell a patient who attends at a follow-up saying that the treatment that you've given them has caused a specific problem, that it was there all along? Well, this will happen a lot. And it happens because if you think about what happens on the patient journey, they will have a treatment. Often if they're on the anxious end of the spectrum, or even if they're not on the anxious end of the spectrum, they'll go home and study their face, and they actually look at their face as if for the first time in many ways. And I've had patients notice things that have always been there for sure: little blood vessels, freckles, lines, wrinkles, asymmetries. They will often come back and say, I don't think this was like this before you did the treatment. Now, most often that fits with an anxious patient. And what I think the most useful thing is, first of all, what do you do to minimize the anxiety for your patient before they've even left? So if you can give them a sense of certainty during the process of delivering the treatment and afterwards, they will leave and hopefully look for the positive result. Now, if they are on the anxious end of the spectrum, they will actually go away with fear in their mind and look for negatives. And if you look in the mirror and you look for long enough and you look with fear, with your fear glasses on, as I sometimes say, you will actually see faults rather than things to appreciate. And this is what I think happens with anxious patients. The ones I've known over the years who've come back with, you've done some toxin around my eyes and now I have a freckle. It was definitely never there. And they often say this key thing, which is, I think I know my face. And I will most often have a photograph and then actually show them. So this is the key, obviously. Now, firstly, listen to them. Don't dismiss them. If they're anxious about something, you need to hear that. You need to understand exactly what it is they're concerned about and why. Then you need to get the photographs out to check that you're both on the same page. I'd say 8 out of 10 times it'll be something that you can actually point out was there already. And the other 20% of the time, it can be really subtle. It can be like, I think the cheek is a bit more, curved, or there's a different shape, or it's slightly heavy looking, and it doesn't always show in the photograph. In which case you need to first of all make sure that you've heard them properly. You can then start to discuss the idea that perception is changing things. And so I always say to patients that your psychological, for all of us, for me included, it's changed by the emotional tone you're looking at with. So if they are scared or anxious, they are more likely to spot a fault, as we've already said, and this sometimes in some people at least open their mind to the chance that they're actually imagining this. Now, before you get to that point, maybe not imagining, but kind of it's more that you exaggerate something that maybe there already, a natural asymmetry which suddenly looks more obvious after the treatment. Now, of course, we can't too quickly dismiss this, so you need to also get back to what your original treatment plan is. Have a look at how you injected them. Have a look at your before pictures and see if you can really make sense of the fact that there could be a problem. Because often the patient will be talking about something that's nowhere near the place that you treated, and you then must reassure them that this has nothing to do with the treatment. It's too far away, or it's the wrong dose, or the product you use could never cause that. And that should at least help things a little bit if they all accept that reassurance. I will say that the less sure you are in your tone, the less they will take your word for it. And you need to be certain in yourself and convey that to them. I think many clinicians often, you feel slightly on the back foot when it's something you don't entirely see yourself, and they're saying that it's there and you don't know how to handle it. And if that lack of certainty comes across in the way you communicate it, you may find that they just simply don't take your advice. So when you feel confident, state it confidently what you believe the situation is and why they shouldn't worry. And hopefully that will help give the confidence that they need, that they can go away and just actually try and enjoy the result instead of look for faults in it. Now, of course, most important thing of all is make sure you're right about this, because sometimes you will have caused an issue, and it's our responsibility as clinicians to make sure that we get our patients in a happy and healthy state. And so don't dismiss them too soon. I see a lot of clinicians very quickly dismissing patients as dysmorphic, and it's not a good idea. You need to listen to them carefully, see it from their side, make sure they understand that you see it from their side, and only then try and change their opinion if you believe that they are incorrect in their assessment. And putting all of that together, in most cases, you'll come out with a patient who understands more, but it does involve a lot of talking. So you can't do this quickly. You need to talk and listen and explain, use mirrors, use photographs, and altogether you should get a good result in most people. Hope that helps.